In terms of treatment strategies, most therapies are based on targeting abnormal blood vessels and causing them to shrink. There is a chemical called VEGF, which is vasal endothelial growth factors, which causes new blood vessels to form. Essentially, think of it as you got problems in your circulation. There is a chemical that is secreted to help generate new blood vessels. Well, this is a great idea if you're a baby. It's a great thing for your heart. It's not such a great thing for your eye. The problem with these blood vessels is they grow in the wrong place and they bleed very easily. Similar new blood vessels are often seen in cancers, especially when they're growing. There are a number of medicines that have been developed over the years to take care of these new blood vessels, but they all work by the same concept. They're called anti-VEGF medications. They try to block or soak up the vasal endothelial growth factor, not only to close the blood vessels down, but to decrease the leakage they've got. The technology is based on cancer therapies. There are four medicines right now that are being used to treat wet macular degeneration. The first one was approved that is still being used as ranibizumab or Lucentis, made by the company called Genentech. It's been around since 2005. The second medicine that's been around even a bit longer is called bevacizumab or Avastin. It's also made by Genentech. Bevacizumab, however, is an existing cancer drug that is currently being used off-label. It's not been FDA approved for the treatment of macular degeneration, but is commonly used because it's significantly less expensive. As I said, it initially was a cancer drug, and it's really given in tiny amounts that you can inject in your eye to close down abnormal blood vessels. The third medicine is called aflibercept or Eylea, made by Regeneron. It works slightly differently. It has something called a VEGF trap that traps the VEGF molecule. It works slightly differently than the first two, but essentially does the same thing. What it does, it causes new blood vessels to shrink and swelling to go down. And it's been around since 2011. The newest medicine is called brolucizumab. It's made by Novartis. Essentially, it's a very small molecule. It's the smallest anti-VEGF. And what they do is they concentrate it into a very small dose. So you have a lot more power in a given dose. And it was approved in 2019.